Hello and welcome everyone to our next session. And today we are going to be starting a new topic, and that is peripherally acting analgesics. Now, in anesthesia, they don't really teach us much about these drugs, but what happens is during the table viva, they will keep simple drugs for you like diclofenac, ibuprofen, aspirin, paracetamol, that is acetaminophen, and they'll ask you, okay, doctor, tell me, how does this drug act? What are its side effects? What is its dosage? What are its indications? And this is the time when you completely become bamboozled. Ki, Arey, they are asking such a simple thing and I don't know the answer to this because I have studied isoflurane, sevoflurane, propofol, ketamine. I have studied all the cardiac agents, but I have not bothered or I have not had the time to actually study about these very basic drugs. So I wanted to cover these drugs with you all a little bit in a synopsis because this can be asked in your table viva. This can also be asked as a short question, 5-mark question in your exam, and you will be expected to write certain things about it. So if you have a general idea about the topic, you will be able to write it. All right. So first of all, let's see what are peripherally acting analgesics. Now, for that, you need to know what is the definition of an analgesic. Whenever I ask someone that what is an analgesic, they always say, ma'am, analgesic is a drug that takes away pain. Correct. But the complete definition of analgesic says that analgesic is belonging to a group of drugs that decreases pain sensation without loss of consciousness. Okay. So in this case, can I call ketamine a complete analgesic? Not exactly. Ketamine does not fall into an adequate definition of analgesic, but it falls into definition of anesthetic. Okay. Why? Ketamine decreases pain sensation, yes. But does it cause loss of consciousness? Yes. So that is not the exact definition of an analgesic. All right. So analgesic is group of drugs that decrease pain sensation without loss of consciousness. So these are our simple drugs like NSAIDs, acetaminophen, clonidine, dexmedetomidine. All of these, they can cause decreased pain sensation without loss of consciousness in the patient. All right. Dexmed again does not characteristically fall into the definition of analgesic because it can also cause something called as conscious sedation. Okay, so there is sedation, but the patient is easily arousable out of that. All right, so let's stick to the basics like NSAIDs and paracetamol if someone asks you what are the peripherally acting analgesics. All right, okay. Now, when we talk about this word peripheral, so in peripheral analgesics, where exactly do they act? So peripheral analgesics act at the sensory input level. What do you mean by the sensory input level? So now, when you look at the pain pathway, so the pain pathway is very intense. Okay, we start off from exactly the point where the nerve is stimulated by causing a painful stimulus. And what receives the painful stimulus? The receptor, which is called as the nociceptor. Okay. So the pain receptor or the nociceptor receives that impulse, the painful stimulus, and then from there it passes it on to a whole pathway of the afferent nerve fiber, then to the spinal cord, the dorsal root ganglions, then up ahead into the thalamus, into the cortex, and all of this is the entire pain pathway. Okay. So my peripherally acting analgesics will act only at this level, at the level of the nociceptor. Okay, so their major action is at the level of the nociceptor. So this point is also called as the sensory input level. This is the point where we actually give the painful sensation to the patient. Okay. And at this point, what it tries to do is tries to block this impulse from traveling all the way through the spinal cord, through all your columns of the spinal cord and then to your brain. Okay. So at the very basic level, it tries to block this impulse. So this is called as the action of peripheral analgesics. All right. Now, when we talk about peripheral analgesics, why are we talking so much about it? Why not just give central analgesics? You know, we can give many drugs like opioids, for example. We use opioids left, right, and center. Nowadays, in fact, people have started advocating that instead of using morphine, fentanyl, remifentanil, try to go for something which is called as opioid-free anesthesia. Okay. So what is opioid-free anesthesia? They say that for pain relief, try to give drugs that don't act centrally. So which are the drugs that don't act centrally? Are peripherally acting analgesics. Try to give regional anesthesia, local anesthetics that will take care of the pain of the patient instead of using centrally acting analgesics. Okay, but why? Why is there so much of a debate? Why do they exactly want peripherally acting analgesics? So here are some of the advantages of peripherally acting analgesics. First thing is that it acts specifically on the target. So when you mean by the target, it means where the painful stimulus is being given. Okay. So it does not really go to any part of the spinal cord or the central nervous system and act. It acts exactly at the nociceptor where the painful stimulus is starting. So this is also, in other words, called as source control. All right. So the source of pain is over here. The stimulus is being given over here. And at this level only, the impulse is blocked. So this is called as source control or target specificity. Then the next thing is that many of these analgesics have anti-inflammatory properties. Okay, so they help in also reducing the inflammation that may be present in the muscles, that may be present in the bones, that may be present in the joints. Now, how is this helpful? Of course, you're taking away the pain, but along with taking away the pain, you're also reducing the amount of inflammatory mediators that are released in that area. Okay, along with taking care of the inflammatory mediators that are released in that area, where do we basically focus on this? So our peripherally acting analgesics, when they act as anti-inflammatory, are very useful for chronic condition. And which are these chronic conditions? Rheumatoid arthritis, osteoarthritis. Okay, if you have a long-standing pain because of a malunited fracture, all of these, especially the bone-related pain, in that case, peripherally acting analgesics are very useful as anti-inflammatory. Okay. Then, as we spoke in the beginning, that these drugs will not be acting on the central nervous system. So, because of no action on the central nervous system, they have fewer side effects which are related to drugs that act on the central nervous system. So, whenever we talk about this, think of opioids. All right. What are the side effects that opioids have because they act on the brain? So, because opioids act on the brain, they may cause something called as respiratory depression. Okay. Then they may cause sedation. Then over a period of time, they may cause tolerance. And because of this tolerance, every time the patient requires higher and higher amount of drug to take care of the same level of pain. Okay. Sometimes this may even modulate with the patient's brain, and it may lead to abuse of these opioids. Okay. Especially if you see in the US, UK, there are lots of people who have weaker opioids like tramadol, oxycodone, just like they're having chocolates. All right. So because we don't have these central side effects whenever we are taking peripherally acting analgesics, we feel that it is safer to give them as compared to dealing with drugs that act centrally to relieve the pain. Okay. Now, because these drugs don't have central side effects,